What's the worst thing you've seen as a doctor? This is the fifth and final case in the series. And just fair warning, this is people will often ask me what's the worst thing you've seen as a doctor, and I never tell the truth because they don't really want to hear what's the worst thing you've seen. They want a funny story or something that's filled with action. But when they ask what's the worst thing you've seen, this is what comes to mind, and it's the case of a child that was no older than 2 years old that I saw in Tanzania, who was unfortunate enough to get in the way of her dad trying to hit her mother with an iron. And she came in to a Tanzanian emergency department with a misshapen head because of bruising and injury, and was still alive, but was dying. And it was and emergency departments in rural areas don't work like you see in films. It's chaos. People are just milling around, and a small child was just sort of brought into the room and laid on a bed in front of me. There's obviously a language barrier as well. I was trying to learn the local language, but there's only so much you can do on a short elective period. And I wasn't even a doctor at this point. I don't think I'd quite got my results, but I was in my final year of medical school. I'm looking for someone who might know what they're doing, because I definitely don't feel like I'm that person. But no one's really reacting. I'm aware that this child needs some sort of scan to tell us the degree of damage that is pretty obvious from how they look. But I don't know if we've got X-ray, ultrasound or CT scan in this hospital, which is supposed to be one of the bigger ones in Tanzania. But sure enough, someone tells me the CT scan is broken. But there is ultrasound, and we can do an ultrasound, which I had never heard of doing an ultrasound of someone's head. But that's because I come from a well-resourced country that does CT scans all the time. Still, no one's really taking responsibility for this child whose breathing is getting more laboured and who is essentially about to die in front of me. We pick up this child and someone leads me to ultrasound. We can see what looks like lots of bleeding just on the inside of their skull. And that's their job done. But now they need intervention. Again, I'm far too junior to know what they need, but they need surgery. They need a neurosurgeon, which would, in Australia or in the UK, be a specialist centre. But we're not going to get that. And so I carry this child again to the only ward that I'm aware of where there's a surgeon doing a ward round, and I try and get his attention, and he's too busy talking to this ward round. I use what's called graded assertiveness, where I essentially got to a point where I had to yell at this man and say, I need your help. And he then whisks this child away into surgery. And that's the last I see of her. And unfortunately, I don't think she would have survived. I don't think anyone could have survived the injury that she had, which I know is horrible to talk about and is triggering, but these are the worst things I've seen. If you're listening, that's what you get. It's because she was between her violent dad, who was attacking her mother with an iron. And it's just why on earth people think violence is okay on any level. And it's probably why I'm pretty passionate about domestic violence and why I don't really like men. And I've talked about this case quite a bit since, because I don't think I realised how much it affected me. I didn't go back to that hospital for a few days after this, and I really didn't know if I wanted to do medicine. I felt like I didn't know what to do and whether I could have done something more. And it's definitely the reason I want to go back to Tanzania with the knowledge and skill set that I have now, because I might be able to help. But yeah, it's a bit of a one. Sorry.